about this? So again, who wants to volunteer for the analysis of the rhythm? Yeah, volunteer this time. Can somebody volunteer? Okay, without raising your hands, just say. I will not look.
Regular.
It is regular, excellent.
No P.
Regular, so how much is the rate? It's about 60? No. 1, 2, 3, 4, 5. Here is 60. 6, 7, 8. So maybe 30.
Yeah,
30 or 28. Okay.
There is no relation between P and QRS.
But there is any P waves?
No.
Sorry, this is also a deflection artifact. These are not P waves. Excuse me?
QRS now.
QRS complex is narrow or wide? What do you think, and what about this one? Narrow. Okay. So of course, because the complex, the P is not there, we cannot comment what is the PR relationship. So actually, when you look at this rhythm, again we have to tell that this is junctional rhythm. Okay. If you decide that this is narrow complex, but actually the complex here is on the wideish side. We decide about wide with 2 points. One is if the complex clearly more than 3 small squares, the normal QRS complex is less than 3. So if it is more than 3, I mean 3 or beyond, this is wide complex. If it is between 2 to 3, some people they say there is it is wide but it's not complete. That's why you can hear sometimes incomplete LBBB. Yeah. So if the complex is little wide, 2 to 3, then we call it incomplete wide. It is within the normal. So that's why we are saying 2 points. The first point is the width. The second point, the shape. So the shape of the ventricular complex, if it is wide, usually in V1, the QRS and the T are discordant. So the QRS complex will be in a direction, T will be in the other direction. So let's see in V1. What is the normal pattern of the V1? V1, everything is going away. So it should be negative P, negative QRS complex, negative T. So here, with a borderline complex, 2 to 3 small squares, you can see that the R wave, the T wave is in the opposite side. So this goes with ventricular beat, I mean a wide complex. Okay? What is...
Can you repeat this one?
Okay. Maybe because I mentioned the word... Hello? So maybe just because I mentioned the word discordant, we have concordant and discordant. If things are going in the same direction, we call it concordant. If they are going against each other, it's in a different direction, discordant. So the complex here is negative. You're expecting that if this is a normal complex, the T wave will be also negative because we are here in V1. But the complex is going in the other way. So this is a sign that this is a ventricular beat, a wide complex. So you decide that this is narrow complex or wide complex, we look at 2 things. 1 is the width. If it is 3 or beyond, خلاص, this is decided, this is white complex. If it is borderline, like 2 to 3, then we cannot tell exactly, but we look at the shape. If the shape is looking concordant, T wave, and the normal side of the T wave, this is the narrow complex or normal QRS complex. If the T wave is disconcordant, then we call it a white complex with disconcordant T wave. Good idea? No or yes? No?
What is the relation between the T wave and the complex? We're saying the T wave shape, we're deciding the complex is wide or narrow. But the complex itself is narrow. How is related?
We will see soon that if this is what to call T wave, and the patient has left bundle branch block, you will have the QRS complex negative, yeah? The QRS complex will be negative. What about the T? It is positive. This is the normal pattern of the QRS complex in the LBBB. The same thing in the RBBB. You will have the complex up with S. It's always discordant. Like if the beat is coming from the ventricle, you will have it discordant. The complex will be in a direction, the T wave will be in the other way. Negative QRS complex, positive here. So imagine that this is V1. We'll remove this one. Imagine that the patient has LBBB. This is V1 and this is V6. Yeah, don't we see the left bundle branch block like this? Okay. So one of the, if a patient has, I think you saw this before, patient has severe chest pain, he had a normal ECG before, severe chest pain, you do the ECG for him, you find LBBB. What criteria you will choose? Barbosa criteria, excellent. One of the criteria is if the QRS complex in V6, if it is LBBB, has a concordant T wave and ST segment. Why? Because the normal pattern of the ventricular beat is to be disconcordant T and ST and S wave. Yeah, like this. So if it is concordant, then this is a sign that the patient has a ST elevation. Okay? So the ventricular complex usually have discordant T wave.
Except in B1 or normal?
In all the leads. If the patient has ventricular beat, so this is ventricular. Negative QRS, so positive T. If this one was normal, and it is in V1, V1 usually have negative P, negative QRS, negative T. So this is a normal beat. If you find it like this, negative P, sorry, there is no P because it's ventricular. You find it like this in V1. You will say, yes, this is LBBB. So? Okay. What proves what I'm saying is the heart rate. If it were junctional rhythm, what should be the rate? 40-60. What is the rate? 30 or 20 something. So this is ventricular rhythm. So this is also another kind of bradyarrhythmia. What are the causes? Again, electrolyte imbalance.